Hi, doctor. Hello, class. This is Andrea here in one of my spare bedroom quarantine because of the coronavirus. And today I am going to be talking about the Candida albicans. I am going to go over the region of the Candida albicans, the name, when it was discovered, um, the effects on the human body, and the treatment. Um, so actually, the first time the Candida albicans was encountered was a long, long time ago. The first person who ever described the Candida albicans, actually, the first person that ever described the signs and the symptoms of the Candida albicans was Hippocrates around 400 before Christ. And as we know, he didn't have a microscope, so he couldn't connect that the fungus was the cause of the infection. So he described the disease as a white thrush in the mouth of his patients. And it wasn't until 1847 with Charles Robin, a French microbiologist, that the fungus was officially discovered and named Oidium albicans. And later in 1923 with Burkhardt, the name was changed into Candida albicans. What does Candida albicans mean? So Candida albicans is an example of tautology. The name comes from the Latin words candida or candida, which means white, and albicans comes as well from Latin, and it means becoming white. So it's white becoming white. I do believe that the reason why the Candida albicans got this name, I'm sorry, is because of in one of its two shade forms, actually the Candida is white, and so that's why becoming white. Characteristic of this fungus. So the Candida albicans is diploid fungus. It is a gram positive, thanks God. So it is treatable and curable, and it has two different forms. It can either be unicellular or multicellular. When it comes to the unicellular form, it is yeast. When it comes to the multicellular form, it is hyphae, and hopefully I say it right. It's spelled Hyphae, I guess. No, I'm quite positive that's the way. And also, we have to understand that the Candida albicans lives in us. It's part of our microbiota. So it is in 80% of our intestines, colon, mouth, and it actually doesn't cause any problem unless the host, like the person, is immunocompromised. An example of being immunocompromised people are people who suffers from diabetes, cancer, HIV/AIDS. And so, as I said, it usually doesn't have any effect on the body until the pH or the environment of the host change pretty much. We have to understand also that the Candida albicans can change, as I say, has two different forms. So because of the environments, the pH and the environment itself, the Candida can change its form back and forth. And so it makes it that this characteristic, this flexibility makes it really resistant. And on top of that, in its multicellular form, the Candida albicans creates biofilm, and as we studied before, we know that the biofilms are really, really resistant, and so that's a reason. One of the reasons why it is abundant in our body, because it creates a microfilm inside our intestines. Also, another characteristic is that the Candida albicans has two different type of phenoms. So two different phenotypes. One phenotype, as I said before, is a white circle phenotype, and another one is a gray rod-like type of phenotype. And this is really important because the Candida albicans itself as fungus is asexual, so it doesn't reproduce through meiosis. But whenever it switches its form to the gray rod-like phenotype, it is able to pretty much, it does kind of I mean, its sexual life, it's better than mine. It does a kind of menage a trois. So the diploid becomes a triploid, and they do whatever they had to do, and then once they're done, they just separate again to the diploid form. And so this is how pretty much these are the reason why we have it. So we have it pretty much since, I'm not saying that we are born with it, but one of the way that the fungus is transmitted, it's from mom to child. So from a really, really early age, we can find the fungus in the mouth of the baby. Another way of transmission, it another way of transmission will be the sexual relationship. So if we have the fungus, overgrowth fungus in the vagina of a female, and a male or another female or a sexual partner, whoever it is, performs oral sex, there is a risk of get the fungus, overgrowth fungus in the mouth, and so and pass it around. Another really, really common way of transmission will be at the hospital, because when you have an immunodepressed person at the hospital and the surrounded by medical personnel, this is a way of transmission too. Common symptoms like related to as I say before, it's asymptomatic unless you're immunodepressed. But if, for example, we have development of the infection in the vagina, we will see discharge, itchiness, red skin, dry skin. If we have an overgrowth of the fungus in the intestine, we might experience nausea, diarrhea, gas, indigestion, being bloated, all the good stuff. But and also another cool thing that I learned about the Candida albicans, it's really, really strictly related to the Crohn's disease. So apparently, a lot of people who suffers from Crohn's disease has been found to have an overgrowth of the Candida albicans in their intestines. So that's really cool. Maybe that is one of the reasons why these people develop the Crohn's disease. We don't know yet. Like researchers has not proved that yet, but I think we're gonna get there. What the research proved though is that Candida albicans is one. It's actually the fourth most isolated microorganism in the bloodstream, and it is important to say that because although it is not pathogenic in the intestines, in the colon, and in the mouth, whenever it reaches the bloodstream, it can be lethal. It can cause to death, because through the bloodstream it can reach the brain or major organs and overgrow there and cause failure of these organs. What else to say? So, oh yeah. So what do we do in case we got a fungus infection? Like, what are the things that we can do as precaution? What I suggest is to like have a really good mouth hygiene. So brush your teeth, clean your teeth, good diet, and a good lifestyle. Protection during sex is always good. In case you get it, don't freak out. Like, it is curable, and there are usually, like, the most effective treatments are by oral medication, creams, or in case you have a systemic infection, there is a different medication, fluconazole. Hopefully I said it right. In Italian, it will be fluconazole. So bear with me. So as I say, it's curable, and fluconazole, as I say, is for systematic infection. Um, mm, there are not really bad side effects um, discovered with the use of the this medication. Although people develop like a sort of like nausea, stomach irritability, itchy skin, but nothing that I'm really concerned about. When it comes to mouth and esophagus infection, then nystatin, it's prescribed. Oh, and doctor, this is a tip for you. Nystatin was actually discovered by two females, and it is considered one of, actually it is considered the most uh how do I say, the less dangerous, the least dangerous medication ever, according to my sources. But it was cool. I know that you're a feminist and you like when females uh, get credit for their job, which I do too. And so there will be oral medication, and as well for this medication there is not really contraindication or side effects that concern the medical uh, researchers. And for topic use, and this is really common, especially in the military, because we all wear boots. The clotrimazole, it's the topical cream that is prescribed most of the time, and that helps getting rid of the fungus infection. And honestly, I never heard anybody complain about it. But I was looking on the clotrimazole website, and within the side effects, there might be like some rash, skin rash, or itchiness, or skin irritation. But by the way, the fungus itself will cause that too. So I'd rather apply the cream and get rid of it in 40 days, hopefully, than have it that forever and ever and spread it everywhere. Uh, so in general line, as I said before, like the candida, it's not really life threatening unless it reaches the bloodstream, and then it causes a candidemia. But if it wasn't for that, like it's pretty curable as of today. Although I have to admit that there is no extensive research on fungus. Uh, like pharmaceutical company, I don't know if I say it right, but pharmaceutical company don't invest that much into that. Mostly what they're looking for is a treatment to cure like chronic diseases more than fungal infections, because it doesn't give doesn't pay back very well. But there is the Institute Pasteur in Paris, actually, that I know that you like, you might be familiar with. They have a microbiology department, actually, the fungal biology and pathogenicity department, and they are actively looking for a cure for all type of fungus infection and related diseases. As a case study, as I say, it's really common. The Candida Albicans is really common. And so I was mesmerized by the fact that most of the people underestimate the Candida, especially when it's in the mouth. And so it was really funny to see, because when it is in the mouth, you have blisters that are really soft, and they look like I will say, I don't want to say cotton cheese, because then you guys are not going to eat cotton cheese anymore and you're going to remember me every time you open the fridge. But it looks like that. And once you pop the blister and you remove the cotton cheese on top, you're going to have a really reddish, irritated skin. And so people, they just associate that with like cold sores in the mouth, or whenever you bite, you chew on your tongue, on your cheek. But it was funny to see that most of the time the Candida albicans it's pointed out to the patient by the dentist and not the doctor. So most of the time people go to the dentist thinking that they have like an oral infection caused to uh, cavities or plaque or whatever they have, and the doctor and actually the dentist refers them to the doctor because they need the antifungal or antibiotic. This is my presentation. I know it's pretty. Actually, I didn't even think about, like, I wasn't expecting to talk for 15 minutes, and I really hope I cover every aspect. I wish I could add like some effects or stuff, but I don't want to. I don't want to make it even longer than what it is. But well, if you like it and I think I should get a hey, just give a thumbs up. And thank you so much. I really hope that you enjoyed this video and you learned something from it. And stay safe. Bye.